Modernization has changed a lot when it comes to social dynamics in Kenya, with both genders working. So how does this affect healthcare, and why is it a concern in the modern world? There is limited time for food production, food selections, and food preparation. You remember when we were growing up, we had access to things like fermented uji, because our moms or even our grandparents had time to actually ferment the ujis, ferment the cabbages, ferment the milk. But currently that is not something that is very common in a Kenyan homestead. As we are speaking, we are having exposure to a lot of processed and refined foods. Growing up, my mom would buy us fries and soda and maybe chicken on Sundays after church. That was the only time that we would have that. But currently the modern woman is so busy that she's ordering KFC and other processed and refined foods for her babies almost every other day. Earlier on this week, Business Daily published a report whereby 50% of all educated women in the country are obese. That's a big number. It will surprise you, because these are the women who are supposed to understand the dynamics of life better. They are well educated, they are well equipped with knowledge, but unfortunately it's so because we have no time for meal preparation, we have no time for meal selection, we have no time for even cooking the basic foods. We want to eat takeouts, and we are not going to control the additives that is going to be added on those foods, from the fats or oils that have been used to prepare that food. Even the safety and hygiene standards we have no control over when we take too much takeouts. That's the first reason. Another thing that I will say contributes a lot to obesity in educated women in Kenya is lack of physical exercise. The educated woman is busy, she's a career chasing woman, she's busy in business. Like for instance, it's very easy for someone to just give you the excuse that they have no time for physical exercise, but no one is telling you to go to the gym for 2 hours. You're a woman, for crying out loud. If you overwork your body, that is bad for you. A day has 24 hours. As you plan for your busy schedules, as you plan for your timelines, please consider planning for like 30 to 40 minutes or even 20 minutes daily of physical workout. There are a lot of YouTube videos, I'll definitely link some for you in the description box, that you can do at the comfort of your house, and they are 20-30 minutes, and you do it every other day, and this will promote your metabolic health. Another thing that I will say is the contributing factor of these cases of obesity in our educated women is environmental and dietary toxins. Unfortunately for us, there's a lot of pollution, there's a lot of toxicity in the air, in the water, even in the soils that we don't have control over, and our government is failing us. These are some of the policies that were initiated or should be initiated to protect our environment so that it can protect us. The air that you're breathing currently, if you are in Nairobi, you get to the CBD, trust me, you start crying. For instance, if I go to town right now, by the time I'm done, even if it's like 10 to 15 minutes, I leave with my eyes red, because there's a lot of pollution, there's a lot of noise pollution. Water that you're drinking, we are no longer even sure about the safety of it. We just drink it because it's available and we need water. That is very bad. You know, our body was not used to actually digest and synthesize and metabolize those toxins. What the body does, it gets shocks, and it has to get rid of those toxins from the circulating system, and one of the ways that it will store it is actually as fat, and this brings about obesity. Another thing, toxicity and toxin exposure in women has been linked to a lot of hormonal imbalances, which has been linked to a lot of obesity in women. Now you see the problem with toxicity. Then we have the toxins that we can actually control. Things like food toxins, like things like alcohol, synthetic sugars. We have things like unhealthy fats, like those vegetable oils and seed oil. Too much intake of processed and refined foods because of the additives, and we have unsafe and toxin additives that we are using, like the monosodium glutamate, which are toxins to our body. So those are bad, and we should actually try to eliminate them. And of course, the other reason that I would say is one of the contributing factors to women having a lot of obesity is stress. Stress has been linked to a lot of conditions, including metabolic disorders like obesity. So how does stress cause obesity? In a stressful condition, your body produces cortisol. Cortisol is the stress hormone. So this hormone is produced so that your body can actually activate the conversion of glucose from glycogen in the liver if you had no glucose circulating, so that it can have enough energy to deal with the stressful situation. But I have talked about intake of poor diets, I've talked about toxins exposure, I've talked about busy schedules. So this means that your body is in a continuous state of stress. like you are stress addicted, and that is very bad because cortisol will be produced more, and once your glucose stores are depleted in the body and your glycogen stores depleted in the liver, what happens is that your body will start having adaptive mechanisms like releasing hormones and other changes to ensure that you increase your food intake. This is why most of us in a stressful situation, or when you are exposed to chronic stress, usually have serious cravings. And of course, one of the things that you're going to crave is carbohydrates or the simple sugars, because your body needs that instant energy. It is important for us as educated women, even as just in general women, that we take up measures and we build measures to help us deal with the stressful conditions in our lives, because stress has been linked not only to obesity but to cancers, to diabetes, to hypertension, to all those conditions that are not so interesting. So what are some of the effects or the dangers of obesity in women? Now, the first thing is obesity has been linked to a lot of hormonal imbalances. I have talked about obesity and hormonal imbalances in length at this video, so you can have a look at it later.